I'm your host, Nancy Trader. Welcome to the Stop Digging podcast, where we'll help you dig out of whatever hole you're in. Here, you can connect with experts to listen and learn from their experience and get advice for your challenges in business, wellness organizations, and relationships. Here, you can borrow from others and find what you need to create the life and work you want.
Welcome to the Stop Digging podcast. You'll notice that I'm flying solo again. Nancy's not available, but we're going to have a good time too. This is the first episode of 2025, and we're starting a brand new theme. It's called Global Works, and we're going to be highlighting some industry and some people in those industries who are on the cutting edge of what's happening in that industry. And one of the things that we're going to be focused on today is we have this amazing guest. I'll introduce him in a minute. We're going to talk about basically a very niche market in the healthcare industry. Many of you know that the healthcare industry is always and has been consistently for the last 7 years one of the top 5 fastest growing industries in the world, not just the United States. And I know we do have some international listeners, so be aware of that. But the healthcare industry is also the number one most stressful industry in the world. And what that means for people working in that industry is they have been flocking into areas of healthcare that have provided better balance and more positive experiences for many of them. And one area that is a niche market that they've been going into is aesthetics. And I will tell you that the numbers are just staggering. The growth rate is that it's a 15.2% growth rate. What that means for this top industry is that just in that niche market of healthcare, it's projected from a 22.5 billion, that's with a B, 22.5 billion US dollars industry just this past year. It's expected to grow to 86 billion within 9 years. That is a huge growth. And what that also means, particularly in the United States, is that businesses are going into it to make money. And we have US med spas that are projected to hit 15,000 new startups within the next couple of years. And if you've noticed some of them opening up around you, you might just be aware of that it is a growing industry. It's getting a lot of notice. A lot of professional healthcare workers are working there, but also it's a huge benefit. Some of the procedures we've heard of Botox, the increase in use of Botox, 759% since 2000, right? Within 20 years, it's gone up exponentially for availability and for safety. Also, 274% soft tissue fillers being used. These are the top 2 procedures that are being done by med spas. However, other things such as inject for vitamins, for hydration, things that go directly into your bloodstream that are helping improve people's health. And some of that is being boosted by a move for anti-aging. And from a workforce perspective, we're looking at people that are staying in the workforce and having to compete with vast experience, but still wanting to be fresh and look professional and attractive and to draw all of that workplace energy into their experience because they want to work as long as possible. It's part of self-care, self-kindness, being. And a lot of these procedures are non-invasive, non-surgical, and sometimes co-surgical, where the downtimes and the recovery times and scarring and all of the other stuff is severely reduced. So it's becoming more and more popular. And among those who have heard of it, this is going to be a special episode for you, but also for people that have seen the local med spa open, but think it's hokey, or you think that you're cheating if you go and find out what it's all about. So listen to this episode and meet our guest and learn a little bit more about it. Let's demystify it together. Our guest is amazing. I know firsthand that this guy really cares about his patients. He is a board certified family doctor. He graduated from USC in 2014 with his residency. He's been a primary care physician. He's been in private practice since 2014. And his primary passion started out, and I think still is, regenerative medicine. And although we're talking a little bit more about aesthetics this episode, I want you to meet Dr. Robert Tracy, and he's going to help demystify what the difference is and how it can help us.
Mhm.
So, welcome,
Thank
Dr.
you.
Tracy.
Thank you for having me.
We're really happy to have you. Okay, so regenerative medicine.
hmm
You said that you started in that.
hmm
What is it and how did you get into it?
Yeah, so regenerative medicine, in my mind, is doing anything you can to regenerate tissue. And this has been around actually for a while, and it started mainly in the sports medicine, musculoskeletal arena. And actually started overseas. Germany and Russia were the first ones to use it. And in fact, some athletes over 10 years ago have been going over to Germany to get procedures. And what they were doing is using platelets to try to regenerate the tendons and ligaments from sports injuries. So
Mm.
that's one big area that started it. And I knew about this when I was in residency. And then I was chief resident my last year, and I got to go to some talks, different things. There was a talk about using, I think it was a dumping, Cedars was building a large regenerative building, basically all dedicated to research for regenerative medicine. And I thought that was pretty fascinating. And they were doing things like eyes, some organs, some other types of tissue. So not just things like sports injuries, but actually trying to get into regenerative medicine for tissues and organs in the body. Now, that is still a ways off, but that's where it piqued my interest on what it is. And so then I went and did some my own research, and I actually went to some more conferences and started learning about what's being done, what kind of biologic products are being used to then stimulate tissue in your body. And that tissue could be any tissue. And we use it for many. We can discuss what areas we use it for. But that's the basics of regenerative medicine, using your own tissue or a similar type of DNA growth factor, something that stimulates your tissue to heal and grow and make it better.
So, really using your own body as part of the healing process, just helping speed it up a little bit.
hmm
Okay. And as we get older, the ability to heal kind of diminishes. So,
hmm
some of these procedures are just coming alongside of our bodies, if I understand you correctly, and helping complete that process for people.
Especially if you take PRP. So PRP has been around for a while as one of the first ones. And essentially what PRP is using a high concentration of platelets that we take from your own body and inject it somewhere. And then after that, the platelets open up, and inside them are growth factors. Those growth factors have been shown to help heal, whether it's tendons, ligaments, collagen. And as you get older, you're right, your ability to heal on your own diminishes because a lot of these places have poor blood supply. So if you take tendons or ligaments, there's not that great a blood supply to these tissues. So as you get older, that alone and age and other factors just diminishes your rate of healing. So if you can get something at that site that couldn't get there or in not enough quantity, like growth factors, that could essentially start the process of.
So, what started off for athletes in a highly competitive industry where you need your best athletes in prime
Right,
condition, it's
right.
now rolling down to general population. You mentioned organs. What kind of organs are they using this for, the regenerative medicine?
There's a lot
Mm.
of research going on there. There's research on different solid organs. I believe liver is one. There's different tissues within the eye that they're trying to regenerate. And I know there's been some people that have done a lot with lung as far as trying to inhale PRP through different mechanisms to try to get it into the lung to help reduce maybe things like emphysema, COPD, even maybe cystic fibrosis. But there's been mixed results with those, so it's still work in progress. And the challenge of those areas is that the risk is higher. And so there were some people who, when this came around, I think hastily started injecting PRP into people's eyes. This was done way off, I think, by clinics maybe shouldn't have been doing it. There's some
Right.
complications. So those, because the risk in those areas are greater, it takes longer to test before that is done on a mass scale, right?
Right.
Whereas things like tendons, ligaments, skin, scalp, even spine, and I can talk about why that's not as scary, they're lower risk. So they're done on more of a widespread basis.
And is it pretty standard that the results are pretty across the board for those popular areas like you just mentioned
That's,
to
yeah, no,
consistently
that's a
work?
good question. And actually, no, that's one of the issues that plagues this area is that the results are vastly different because there's no standardization of technique. When I started doing PRP, there were basically different ways to do it. And there are companies that came out with kits, mechanisms of trying to standardize, say, for instance, how much blood you take out of someone's body, which would equate, if they had a normal platelet count, how you prepared it a certain way would equate to a certain amount of percentage above your normal platelet. So 2x, 3x, 4x, whatever. But in reality, there was no standardization, and this was a new area. FDA had not, still doesn't have a standardization of this. So a lot of the stuff was being done off label, as we say. And so the kits were different. How clinics prepared PRP was different, which meant your rate of success would be different, which in some ways could give things poor reputations because then maybe some people go to one clinic and say, I did it, I didn't have any success, it was expensive, and I didn't. And so I don't recommend doing that. And that's part of the problem without standardization.
Is that pretty standard through the health industry when they're trying to find breakthroughs of things? Because we all hear about those big studies, like the big disease research, where it's all contained and standardized.
Yeah, the difference is everybody knows about large drugs that come out, and there's a lot of controversy these days with drug companies versus a lot of government and drug prices and stuff. The big difference is when a drug comes out, the amount that you're going to use widespread on people. The studies have been much more intensely studied, basically. And that costs a lot of money. And so that's part of the reason. That's not the whole reason, but that's part of the reason that that drugs can come out and be used fairly widespread. And the FDA knows about it and they've seen the studies. It's something like that's more out of that realm, then yes, the standardization is not there. And so the results are varied. Whatever new might be coming. And so again, lately in the last 5 years with the regenerative side, we had PRP was great and we still use it in the US a lot. But as we've talked about, even, and we can get into later, as someone who knows about how the regenerative arena is going worldwide, and we talked about Korea and how we can talk about later about the aesthetics craze there and how it drives the industry. There's newer things coming out that some people think might be better than PRP. But again, as they come here, there's very little standardization of it. So how it's applied, with what mechanism it might be applied, is it produced the same way from companies every time they produce it? And how do we know they're all producing the same way? These are all variations in
Are there
this
certain
realm.
companies, because I'm assuming that it's the companies that are driving the research because they have their own devices for drawing the what was it, the
PRP.
PRP.
Mm-hmm.
And so if the company's doing the research, they obviously want it to go their way, but they're tracking this stuff. Are there certain companies that are emerging as setting the standard for improvements in that area, or is it coming from outside the US?
I'd say for the US, for PRP, there's a few companies. In the US, I'd say there's probably about six, what I know of, 6 or 7 PRP sort of companies. So these are companies that make the kits and they try to sell it to doctors to use their kit to prepare the PRP. Okay. There's other companies. There's one from France I know of. There's also some Korean companies. The issue when there's overseas companies, again, is trying to get that approval to sell it here, not, how do I say, under the table, basically to doctors, like they'll confidently sell it to doctors and say that, yes, we have FDA awareness of this product, let's say. Okay. But out of all those companies, in the US, we'll say, because that's what I deal with the most. There's two that generally have the best kits. And the reason is because they've done a better job of standardizing their kits. They understand the amount of platelets you need to do a good job. Going back to, if you take blood out of your body and say we're going to inject it into your skin to freshen up your skin, okay, rebuild collagen. If we just take your blood, and there was a famous picture by Kim Kardashian. She started the big sort of microneedling vampire facial craze about 6 years ago, we'll say. And it looked like it was basically blood on her face, like straight blood. And that's not what
Mhm.
we do at all.
Of
There
course.
was some controversy at the time, people
Right.
using her pictures, and she didn't. But I will say what we don't do is just the difference between kits and the way people do it is we don't just take your blood and we inject it onto your face or into your face or whatever we want to do. We have to get a certain amount of platelets. We have to extract the platelets from the blood. We only want those platelets. We don't want red blood cells. We don't want some other stuff. So if clinics said, I know so and so, they want me to buy their kit, but it's very expensive. And I'd rather not spend that. I think I know how to do this on my own. I'm going to do it another way, a cheaper way. So they'll do it like that, but they're not quantifying the number of getting. They don't know if they're getting.
So it's not the amount of blood, it's the amount of platelets, and you have to have an excellent measuring system for those, how many platelets and where you put them.
It's a little bit of both. It's the amount of platelets, but we can only get the number of platelets as far as how much blood we take from you. We can't
Mm,
grow the platelets outside.
of
Okay.
course.
So if you were to go to a clinic and they take, for instance, when I first started, I didn't know much about it. And so I started with a kit and everybody was like, oh, just it's 10 mils of blood, 10 mLs of blood. Very easy for patients. That's it. But what we didn't know with that kit, 10 mLs, we were only getting about 1 to 1.5 times the baseline, which means regular amount of platelets to maybe 1.5 times your normal platelets. So my results initially, and this is a perfect example, say with hair, I did that for a while. Results were like very hit or miss. I had some patients who were like, yeah, I think I could see something. I had a lot of patients who were like, I could tell they weren't very satisfied. And so it's obviously frustrating for me to do this. I want to do things that help people, and I don't want to charge them money and go through their time, my time, if it's not a legit thing. But we didn't know at the time. And again, going back to sometimes you rely on the companies to do the research and their sort of product knowledge. Then you have to get wise and have some experience and then know that what the companies tell you isn't always true, and you need to figure out quickly by patient results what you need to do that helps, right? That actually works. And so it's the amount of blood you take and it's the way you actually process the platelets. So when I first started, I was taking 10 mLs of blood. For a hair PRP now, and I'm one of the few probably in LA, Orange County, there's a handful of us that does this. I'll take sometimes 60, anywhere from 40, 60, 80, 120. I've even taken 160 mLs of blood. So imagine going from initially 10 mLs all the way now to 10x that amount of blood. And a lot of my patients have never gotten that much blood taken out of their body at once. So that's a much larger procedure than they're used to. And the reason why we do that is because we know now to stimulate hair, you need at least 5 times your normal concentration of platelets. And if you don't get that, probably not going to have good results.
Okay. That leads me to my next question, because when we're talking about regenerative medicine, how is that linked to aesthetics? What's the difference?
Yeah, it's a good question. They're really linked, and there's also a big difference, right? Going back to regenerative medicine is a global term for anywhere in the body. And as we hone that into aesthetics, we're talking about the biggest thing to come around in the last, say, 7 years, really in the last 5 years, is scalp and skin, face, skin, normally. That's good. But we can do other parts, but that's what normal people come in for. And as far as the face, the biggest thing that's come around, I think, is our understanding and our drive towards collagen, attacking collagen early, collagen and fibrin early before it gets too late. So you can start tightening and stimulating collagen. So we use regenerative medicine to stimulate collagen or stimulate hair follicles. And that's where they tie in together. That's
So is it
probably the
more
bulky thing I do.
so in aesthetics, if I'm understanding you correctly, it's more preventive. Is that
Yeah,
what
it
you're
is.
more
It's
saying? Okay.
preventative and it can be both, but it's best done earlier on.
Before you think you need it.
Yes.
Okay. That's good for our community to know, because if you're listening to this and you're thinking, "Oh, I've got some time. I can wait till I'm 40, 50, 60." You can still do a lot of procedures to get back to where you want to be, or to just feel better about yourself. But if you start earlier and build this into your healthcare regimen, you may find that it will be more effective in the long term.
Exactly. Right.
So tell me some of the aesthetic procedures that you do and how you're different from other people. Because I'm assuming that since there's not a whole lot of standardization, how would I know as a consumer whether I'm going to a hokey place or not? Like, you're a medical doctor, but a lot of these med spas are not run by doctors. They're run
Right.
by nurses, nurse practitioners, and sometimes not even that. They're just trained on the machines.
Right.
So, what questions do you ask, and how are you different?
Yeah. No, that's a great point. In LA and Orange County, where we're at, as you can see, there's new med spas that pop up all the time, which, like you in your introduction, can be good, but it also takes a little more work, I think, on consumers to vet out those places. And I see it firsthand because in my medical side of my practice, I actually train nurse practitioners, physician assistants, and medical students. And I'll say that 50% of the nurse practitioners that come through my training time with me have already worked in aesthetics as an RN or planning on doing aesthetics when they graduate. And they already know right away that's what they want to do. And for various, as you brought up, stress of other areas of healthcare, economics, personal life versus professional life, aesthetics offers them a lot. But it also means sometimes I feel like they think that maybe it's easy, or maybe they see the glamorous side of it as like they can have an Instagram page and they can show off that they're an injector and stuff like this. But there's differences, levels of understanding, I think, when you're getting into regenerative and medicine with aesthetics, going back to what even basic with PRP, different levels of understanding of what really you need to know, I think, to understand at a deeper level what's happening in the skin. And I don't think everybody does know that, to be honest. And simply knowing that if you're going to grow hair, it's hard to grow hair, to be honest. And that even when you start early, it's still hard. And you have to know what kind of platelets, like, again, going back to how, just knowing what the process is, what kits to use, and how often to do it. It takes a lot of sort of background knowledge, reading, keeping up with things. And I find that I consult people all the time when they come into me for hair loss. We'll say they've been to a few other places. And I tell them what we do. And I'll say 9 times out of 10, most people say, I never knew that about that. And they never told me that at the other place. Most people then end up doing the procedure with me because I feel like we just, one, have a greater knowledge, deeper understanding of it, two, let them know exactly what, like, why, what they need to be aware of. And I'll tell people, if you're going to go get other consults, it's fine, but you should ask them, like, what concentration of PRP do you actually get? Is it necessary to get more blood? How much blood do you take out? And when you're a consumer going around to a med spa and they just say, no, like, your hair is thinning, you're shedding hair, that's okay. We got PRP for you. We have it. Don't worry. And they sign you up to a package 4 times, 5 times, whatever. But you don't know their PRP is any different than the PRP that we do, or another maybe prominent doctor that we have similar. So consumers don't know that. They just think PRP is the same, or whatever they're doing is the same. So you asking those questions, what are you going to do? Why are you going to do it?
And if they don't know, you shouldn't go ahead with them. Right.
Probably.
One of the reasons that I have you on here as a guest is because I know that you are very passionate about educating the people that you
Yes.
encounter about the different procedures, and you don't sugarcoat it.
Right.
You don't say, oh, yeah, you just do it. And you're aware of the industry and you tell people that. So there's a difference between something being a small risk to do, but it doesn't matter whether it's a small risk if you don't even understand what the risk is. So
Right.
I think maybe understanding the industry, the risk, somebody who has experience beyond training on just machines. So the difference between a doctor and an RN, there's some things that definitely overlap,
Right.
not to speak to capabilities, but there is a depth of knowledge about the way things work that you should explore as a consumer. It's part of the self-empowerment process.
Mhm.
The self-development industry is huge. People always want to improve themselves in some aspect or another, but educating yourself as well can protect you from just jumping from guru to guru.
Right.
And so, one of the things that I gleaned out of our conversation is you should make sure that you're working with a medical professional. If something goes right or wrong, they need to be upfront with you about it. And more than just a disclosure sign sheet, they need to explain the process, explain what it does, explain what to expect, and be part of the educational process so that it's more of a partnership, number one. And then number two, be sure that you do a little bit of research on the front end to know the questions to ask.
Exactly.
So it's a partnership thing. There's always the skeptics who are going to listen to this and say, why do it at all?
Right.
And what beauty is natural and it shouldn't matter. If I'm
Right.
capable, if I'm skilled, they'll hire me anyway. But we know reality isn't always that way. And I do think that the idea that if we wear makeup, if we wear jewelry, if we wear nice clothes, those are all things that make us feel better and they also improve our lives. And so this shouldn't really be any different, but we do need to educate ourselves a little bit about it. If we know what our clothes size is, if we know the earrings that we like, if we know the makeup that matches what we want our look to be, then why wouldn't we learn a little bit about aesthetics and what it would take to work for.
No, it's a good point. And I get that question a lot too. And I have people that come in with all varying levels of what they want to do, intensities wise. But you're right. I think having, say, just nice looking skin, right? And you're right, going back to having to wear makeup or spending money on all those kind of things that you talked about to make people's appearance better. But in reality, if you start with the skin first, it will go a long way. And we have such good tools now, going back to combining regenerative with simple things like microneedling or microneedling RF or some of the lasers we have, which can be much better, lower downtime, but used more as a maintenance. Then you can do these things earlier and more often to prevent things instead of just waiting because and you might think there's nothing I can do. I just need to cover it with makeup and look, that's the way I'm going to look. But the tools we have now are just so much better than what we had before. The machines we have, the regenerative medicine we have, it just makes sense to start earlier. I see nowadays a big trend is people are starting Botox early, and that's much different than before. Before they probably started when they were 40, 45, typical
Right.
arena, typical age group when people start doing things. But on the Botox side, and Botox is a brand name for a type of neuromodulator, they'll start earlier, wanting to prevent the wrinkles. But from a skin standpoint, it also makes sense to start tightening the skin earlier, start brightening the skin earlier, keep the collagen tight, prevent against the fine lines and the wrinkles, and it doesn't take that much to do it. You're right. The risks are much lower than they used to be. They're not without risk, but they're much lower. And we have machines that can do it with much lower downtime if somebody wants to, or we can do a full force, high downtime resurfacing. But the trend is to do more on a maintenance cycle, lower downtime things to keep the skin tight and bright, looking nice. And you may find that you don't have to, you're right, you can present yourself maybe more confidently in wherever you're going. You don't have to wear as much makeup. All these things come into play.
Hello, friends. Thanks for listening. A Squared Lamp Groups powers this podcast. Their memberships are tax-deductible donations that directly support their work developing people and organizations. But just for you, they're offering podcast listeners a special 40% off coupon code to join. Your benefits as a member include additional resources, perks, and access that you can use all year, including an additional 30 minutes of bonus podcast content for every episode. Simply use the code 4listeners at checkout. That's the number 4, all caps, listeners at checkout. They also are giving our listeners free gifts to use now. Go to their website, asquaredlamps.org/podcast, and download your free My Success Course of Action worksheet. There is no cost, registration, or sales pitch involved. Just click it and save. Use it to work on something significant to you this month, maybe even something that sparks interest from today's podcast. Then click to join our free but private Stop Digging Podcast LinkedIn group, where the conversation continues between you, the hosts, and our guests. Don't forget to subscribe and share this podcast with your friends. And now, back to the
So much
program.
resistance sometimes here in the United States to just do that. You mentioned that Korea is driving a lot of this. Tell me what the difference is, because the priority of self-care, the perception can change. Think about, for example, breast exams for cancer. It used to be something rare that only if they thought there was a problem, you would get a mammogram, or if you were over 60, let's say. And now they've built that into your medical care, that as a woman, sometimes men, but definitely as a woman, you have to get your mammograms every 2 years, every year up to a certain age. So they built it into the healthcare or your self-care as a recommendation, but we haven't really done that with things that are not disease related. But
Right.
that's not true everywhere. So
Right.
tell us more about Korea.
Yeah. In Korea, and so going back to Korea is very forward on the aesthetics industry. And I actually went to Korea about a year and a half ago now to check out a regenerative product there that I use. And I've been working with Korean companies and following their trends. And in Korea, they really do build it into their routine, not just Botox or not just, they don't do a ton of filler, but it's skincare starting in their 20s. Okay.
Oh wow, see, that's young. I wouldn't have thought that young, but that's when you start your habits, your adult habits.
That's when you start your habits. And if you look at the aging of skin, after the age of really, even after 25, collagen starts degrading slowly. And every decade it degrades more. So people still have a perception of, I'm 35, 40, I'm just starting to see the fine lines, but underneath, the collagen could be getting, and I could talk about, but the process of collagen degrading is a longer topic. But the Koreans understand that the earlier you start, the better chance you have to prevent. Just like anything we do in medicine, right? Again, going back to getting mammograms early, getting colonoscopies earlier now, these are all things we do to prevent major disease, right? Obviously, aesthetics is not a major disease, but we have the tools to start earlier to prevent these things. For instance, in Korea, it's very common to go get a regenerative product and microneedling starting in the early 20s. And they just do that. They build that into their routine. They like to have good skin. They value good, tight, bright skin. They also stay out of the sun much more than the US does. That's built into their culture as well. All those things just lead to earlier preventative care, aesthetic care, basically. And they're the leader, hands down, almost in the world right now. So a lot of stuff we do here is being driven by the trend.
And they have developed a number of processes as well as products that they
Mhm.
use and recommend around the world. And you use some of them. What are some of the ones that you use here?
Their thought is they think PRP is old news at this point.
Mm.
And they've started using DNA from different, either plants or animals. They find DNA that's similar to human DNA, and they are able to then use that to stimulate collagen in your skin. And so I've done, when I was over there, they did what's called mesotherapy injections, of it. And I started doing that here in the face and the scalp, followed by a microneedling protocol to drive it into the skin deeper. And so they use ultrasound much more than we do to tighten deeper fibers of the skin of the face. And so they have protocols that kind of they follow to do this. I've been a little bit on the forefront of using some of the stuff that they do. And some of that is because a lot of the practitioners here, doctors, stuff, they just don't, if they don't follow it too closely, they don't really know what's going on there. They see it when it comes down 5 or 10 years later.
Okay. Is it more regulated in South Korea for research?
I'd say it's probably on par because the Korea FDA is fairly similar to the US. They model the US FDA process a little bit,
Okay.
but it's just the sheer number of doctors that do aesthetics. They
So it's
follow
just
you.
more available then.
So they have more research to be done because they have so many people doing it, and the doctors are in competition with each other. They
Right.
drive to outdo each other, and that drives, just like in the medical world here with medications and cancer drugs, that might drive different companies to outdo each other because they want to make more money, and so they want to come up with another new drug. But the aesthetics world is very competitive, and so everybody has to find another way that they can maybe be better. Otherwise, there's almost too many aesthetic doctors here. And that
Right.
drives research, that drives innovation.
Got it. So maybe that's something we'll see in the United States in the next 10 years as we move forward,
Mm-hmm.
which kind of brings me to the whole aesthetic process is that it's not just if you get to your 60s and you're listening to this program and you're thinking, I did not start in my 20s. Back
Mm-hmm.
when I was 20, I was spreading lard on my body and
Mm-hmm.
sunning myself in at the beach.
Right.
It's not too late. So there are surgical and non-surgical
Mm-hmm.
procedures. And so some of these processes that you're talking about can still be done in conjunction with surgeries, but sometimes you don't even need the surgery when you think you do. I saw a couple of photos that you had of patients that were extraordinary. Someone in their mid 60s, when they
Mm-hmm.
came to you, sagging jowls, and they did not get surgery, but after what, one treatment or two treatments? I don't even
Yeah.
remember, but the one you showed me, it was extraordinary how it must have knocked, in my opinion, maybe 15 years off of that person's
Mm-hmm.
face. Their skin tone and everything else was it was just amazing. And it didn't make them look like they were 20. It didn't make them look fake. I know that some people who are a little bit reticent about getting some of these new procedures, they hear all of the terrible war stories of
Mm-hmm.
people who overdid surgeries or
Mm-hmm.
procedures gone bad, and it scares them. But
Mm-hmm.
in your opinion, you haven't seen a lot of those kinds of studies.
No, I mean the good, again, going back to the tech, yeah, the technology we have is just is advanced a lot in the last 5 years. And going back to that patient you were talking about, I think she had done around, and now we do combinations a lot. So I think she had done around maybe 2 or 3 sessions of combination therapy treatment, which means something to reduce the pigment. So the sun damaged pigment, everybody is familiar. Sometimes they get brown spots, red spots, all this stuff.
Right.
But then also do something that's much deeper to stimulate collagen using energy. And again, going back to what we are talking about, PRP, which is a biologic, a regenerative, but regenerative also just means regenerating something. And energy can regenerate collagen, which is a classic way of doing it. There's radio frequency energy, there's laser energy. These are energies that go down into the dermis where the collagen is. And when you're younger, the collagen is very tight like this. When you're older, the collagen just starts getting looser and looser, saggy, saggy, saggy. So again, going back to starting earlier to prevent this is the best. But if you're already in your 60s, even in your early 70s, you're starting to take better care of your skin. The energy we have can really get that collagen back into a shape again. Not perfect, obviously, but and the reason is just because the machines are safer. You can do them with less risk, with less downtime if you want, and just have to do more of them. But using something like a combination, like a newest machine I have, we can resurface the superficial fine lines and wrinkles. and pigment. But at the same time, through the same exact hole that it creates, it'll send another second laser deeper into the dermis to now use heat. And heat is one of the most fantastic ways to stimulate collagen. It denatures the collagen, it breaks it down, and then the collagen grows back together again, tighter. So at the same treatment, you're getting two treatments in one. And these lasers now are going to be considered the gold standard for treatment for non-surgical. And at the same time, now you've created some microchannels in the skin. You're resurfacing. If you want to go ahead and layer that with PRP or the Regeron product from Korea, any of these products, you now put it on. Now you've stimulated almost all aspects of skin. The superficial layer, the deep layer with heat. Now you're putting a regenerative product. It's going to help heal faster and stimulate more collagen. And these are just things that we didn't have 10 years ago.
Do these procedures hurt? Because that's going to be what somebody who's never done this before, that's what they'd want to know.
Yeah.
Do they hurt?
The deeper treatment we do, the longer we want to have some numbing time for people. But I would say the pain, even though we have so going along with better technology, the pain has reduced just in the basics of the technology, the way we fire the laser, the way the lasers are pulsed, all this type of technical stuff really reduces the pain. I would say pain back then, probably 15 years ago, if it was on a certain CO2 resurfacing wasn't 8 out of 10, this is with nothing, or 10 out of 10, let's say, if you didn't do any numbing, now that same procedure would be like a 5. Now you add numbing cream onto it. We try to get down to like 2, okay? We can't promise that there's absolutely no pain, but because we are also doing some procedures, it depends on the amount of energy you want to use, obviously, but we can get it to almost no pain and just do more things, more of them, or we can talk with somebody and know what their reasonable pain tolerance is, let them numb for longer, and we can get a deep procedure with relatively little amount of pain. We've never had anybody who have been, and if somebody's uncomfortable, we can always reduce energy and again do it more
But
often.
these are outpatient procedures, and you're not actually like when we're talking about pain, it's not like they need painkillers because
Right,
it's that painful. We're
right.
talking about minor
We're talking
skin
about topical numbing
irritation.
cream. We have a very strong topical numbing cream. We're talking about putting on that, leaving it on there for 30 minutes to an hour. That is usually sufficient for most people, 95%. Sometimes, if we still want to do a deep, intense treatment, we can do some injections around to numb some nerves. That's a little more rare, but no anesthesia here. You're not going under any anesthesia, no scalpels, no cutting, no operating room. It's nothing like that. It's done in our office. We put some sunscreen on after you. We hydrate and you're out the door. So it's just a high level of non-surgical that we can do now. But the great thing is we can do all levels, even sometimes on the same machine, which we couldn't do before.
That's pretty amazing. I guess I would equate it in my mind to the laser surgery for people's eyes.
Right.
Because I know in like the early 90s, everybody was doing it. It was the hottest new thing, but not everybody was doing it right. And a lot of people lost their sight, and there were horror stories and things like that. But the technology has become so good and the procedure so well known and well documented that now it's almost people don't even think about it. You can go in a little bit nearsighted and come
Right.
out a couple hours later, and yes, there's discomfort and you'll have eye drops and follow-ups surgically or medically, but it's not as impactful or scary now. And I guess the aesthetics are moving in that direction where it's made it past that we're just testing on you, and it's well beyond that at this point.
Right.
There's documentation. It's not standardized, but there's lots of documentation out there. There's questions that can be asked, there's processes, there's machines, and there's documented results that are happening, that if that's the desire that you want, you can do that. And it almost seems like aesthetics is even more than just being part of the Western medicine solution to surgical or co-surgical healing. It's also meshed in with some of the Eastern medicine holistic approaches of hydration, internalization of alignment, and
Hmm.
vitamins and things like that feed your
Hmm.
skin from the inside out, as well as these aesthetics. So it seems like a perfect merge for
Hmm.
both of those. Now, I know that our listeners are going to want to know if you have a special deal for them for listening to the show. And we will advertise this, but I happen to know that you are offering something for people to start their new year off right and get this part of their regimen. So, why don't you talk to us a little bit about it? It's a New Year's skin and hair resolution that you might have. If you're 20, you got to start now. If you're older, like we are, don't be afraid to start somewhere. Just build it into your priorities. And most of us are working 20 years longer than we have in the past. And so this may be an investment in your future work life as well. Tell us what you're offering our listeners.
Right. Yeah. So I think going back to just the new year, and it's always a busy time for us. I think a lot of people start thinking about what they want to do in the new year as far as their maybe their exercise routine, their skin, their hair. For the new year, we're offering a couple of different packages from all the things we do. I know we have a package, I think $300 off a laser skin resurfacing package. Now, this going back to one of the newest machines we have, they offer the Cool Peel. Is a very low downtime resurfacing. It's very mild, but still effective. It's a great introductory laser for someone to lasers, basically.
So, is that the combination machine you were talking about?
That's the combination. Yeah, you can get one, which is a CO2 cool peel, which will kind of resurface the outer layer of your skin, make it look nice and bright, look refreshed. You do this as a series of three. And then we're offering, I think, $300 off that package of three. You can combine that with a fusion. The fusion means we're doing the cool peel plus the deeper dermal stimulation. So now you're getting a little more energy involved. You're getting both layers of the skin, superficial and deep, still mild in that your downtime will be much lower than a traditional CO2, but you're getting all layers of skin, and you can use that money off of a package of that. So, say if you're younger and you're like, I don't really want to, I just want my skin looking better. I've never done laser, but I want to try it out. Cool Peel, hands down, is for you. If you're a little bit older and say in your like late 30s, early 40, you still don't want a lot of downtime. You need to start tightening up your skin as far, and also you want your skin to look brighter as well. Cool Peel
Okay.
Fusion is for you. Say you're a little bit older than that, or you just have accelerated age. Maybe you want to do a deeper resurfacing and tightening. You're okay with some downtime. You plan it in your schedule. Take a week of some redness. You might want to do a deeper one-time resurfacing. And that the advantage of that is you can do once, and maybe on an annual basis, you just do a one-time treatment and that will last you the whole year. Okay. The other thing is going back to hair, since we do skin and hair, is I have two things for hair that we're offering. One is stimulating your hair. If you've been dealing with hair shedding, a little thinning hair, you think you may have some genetic hair loss, whatever you might have. One machine that I love is Alma TED, TED, stands for Trans Epithelial Delivery. This is a device that allows us to use ultrasound to infuse growth factors into your scalp. And we use it for skin as well, but it was traditionally designed for scalp. So the no needle, no pain, absolutely no pain at all. And it works great for especially females who are having some shedding, thinning. They may not have real serious hair loss, but they notice their hair is just getting thin in certain areas. They know it's not as thick as it was. A
Mhm.
series of four Alma TEDs, and I think we have a special for that as well, $300 off, I believe. We've been using it now for a good year and a half. It's worked I'd say about 80% of our patients have noticed, even after the second treatment, less shedding for one, and then increased density in their hair. So I like that machine because if you're scared of needles, which we would have to do with PRP, the Alma TED is perfect because there's no needles involved.
Now, would
Um,
that replace things like specialized shampoo and topical things, or is it in conjunction with, or what is your
well,
normal?
you could say it's a conjunction because nothing. So shampoos and things you buy over the counter will never penetrate down to your follicle like either
Mm.
the Almated or actual just injecting with a needle. I think if you're having hair loss or hair shedding, starting deep into the follicle is the best way to go. And unfortunately, topicals like shampoos, conditioners, serums you might buy, medically, we don't think they probably get to the heart of the problem very well. They might make your hair look nice, but you really should seek maybe a deeper sort of treatment level.
So it doesn't stimulate the hair growth. It might make your hair thicker or healthier or stronger, but maybe not generate new growth. Correct?
So nothing we can do can generate new growth out of a bald patch. Let's say your
Okay.
hair is completely bald there, or you only have a very small little hair. But it can, if your hair is viable, and most females that I see have something called telogem effluvium, which is where the hair is not dying, it's just shedding rapidly.
Mm,
So the great thing about Almatet is it can kick that hair back into a growth cycle. So
okay.
now your hair is not shedding, it's going to its terminal thickness. So your hair now will feel thicker because when you're shedding all the time, your hair is never hitting that thickest terminal thickness cycle and it sheds before it hits that. So your hair feels thinner. And that's a perfect example of what the Almated can work for.
But this also works for men too, and I should point out that a great many men are taking advantage of these aesthetic breakthroughs and procedures. It's not just for women.
Mm-hmm.
So it's not just a bunch of women trying to look beautiful. It's also men trying to look fresher and more who they are as they age as well. So these are all relevant for men and women.
Yeah, it's a perfect example. We actually infuse the TED serum, which is growth factors, plus a medication called dutasteride, which blocks the hormone that actually causes miniaturization of hair and androgenic hair loss. So we're one of the only clinics that actually combines the TED with an actual proven medication and infuse it into the scalp without needles. And so we have a whole protocol developed around that I actually developed from a doctor in Spain about 2 years ago, going back to understanding where these things are coming from, looking at research, looking at what other clinics around the world are doing this, and collaborating on research efforts. That's just what we do in my clinic, because that's what I like to do.
So it's not just because I know what's out there. I've seen a lot of articles and things about beauty and hair growth, and a lot of men think if they just take testosterone, it's just
Right.
gonna make them grow hair again, or hormone
Yeah.
balances, which can
Right.
affect it, but it's not necessarily targeting what you said the issue was. So you're offering a deal to our listeners for laser skin resurfacing and
Tightening.
collagen
Mm-hmm.
stimulation and also an Alma TED hair treatment,
Mm-hmm.
$300 off.
Mm-hmm.
And you had mentioned offline another graft treatment. Tell me
Mm-hmm.
about that because I don't remember the name of it, but
Yeah, so going along to our hair treatments that we do, and I'm a big proponent of this, is FUE hair transplant.
mm,
And what that is, again, going along the lines of the advancements in technology we've had, hair transplant advancements have come a long way in that we can do hair transplants now. We do them by individual follicles. And so what that means is one is much less risk of scarring, much lower downtime. When it's implanted into the areas that you need it to be, it looks far superior than they used to look. And in fact, these days with FUE, which stands for follicular unit extraction, again, it's extracting each hair follicle one at a time. It takes a long time to do. The procedure takes a long time. I would say it's considered a minimally invasive surgery. So it's not cutting. We're not cutting. Again, this is not using a scalpel to cut full tissue out. It's cutting each individual follicle out and then implant it into an area that might be needed, frontal hairline, front. We do it on females and males alike. And because I think it's such a useful tool, going back to your question, is Almated or PRP can't actually regrow new hair.
mm.
That's the limitation. That's a technology we don't have yet. That's being worked on, but we don't have it available. Whereas to inject something like a DNA into your scalp and then regrow hair from that, we can't do that yet. So the non-surgical hair procedures we do, you need to have a viable hair follicle there. But if you've lost enough hair, say you're a male, you've lost enough hair and you're not really happy with the way your hair looks, or you're a female, you've had hair loss for a while, you just didn't know what you could do, and unfortunately you've waited long enough that your hair is pretty thin in certain areas, using a combination of regenerative or the Alma-TED, and then just going ahead and implanting hairs into that area is the definitive treatment for that. And there's just nothing that can replace that, because you're putting viable hair into that area, and that the success rate is great. And because I think it's such a great procedure, we're offering a discount for that. I think it's 250 free grafts, and most people require between 1,700 to 2,200 grafts to fill in an area of need. And it's a 1-day procedure. Again, no anesthesia where you're put to sleep or anything like that. We numb the areas up locally. And so I'd say a lot of people have heard that the procedure is painful for hair transplant. There's all these, it's not. Most of my patients have wondered why they didn't do it before, because they believe that it was going to be so painful and so awful. The way we do it now, again, technology advancing, it's really a comfortable procedure. It can be done in a day. In 6 months, you will have new hair. And we combine that with the regenerative to keep your other hair going. So now you're just going to get your hair will take the benefit of all the technology we have.
So you're just building in some new health practices into your regimen as you get older to address some specific issues. And that's for
Mm-hmm.
men and for women. It's
Mm-hmm.
not magic, people. I will say this, that these offers are for our listeners. Dr. Tracy can be found at rejuvla.com. And
Mm-hmm.
do you want to spell that out for us?
REJUVLA.com. So rejuvla.com.
And he has offices in Orange County as well as LA County.
Mm-hmm.
Also, if you are a healthcare professional and you are intrigued by everything that Dr. Tracy has said, and you're wanting to explore this industry or this job opportunity for the healthcare industry, please reach out to him. He is on the forefront of training other professionals, nurses, practitioners. He talks with other doctors. He's connected with surgeons. He's the guy to talk to. So please definitely reach out to him. He's definitely a resource for you and your community. So thank you for listening to this show. Take advantage of this opportunity to learn more about yourself and your self-care, especially in this new year. And listen to the next episode of Stop Digging. Thank you, Dr. Tracy. Appreciate you being here.
It's been a pleasure.
And if you're one of our members for A Squared Lamp Groups, hang on, because there's another 30 minutes of bonus segment. Thank you.
Thank you for listening to the Stop Digging podcast. We hope you enjoyed the conversation. Please like, subscribe, and share with a friend, and connect with us on our social media channels. This podcast is powered by asquaredlamps.org.